Well, another mass shooting yesterday at a Texas mall left 8 people dead and 7 injured. And closer to home, 5 people were shot on a Redwood City sidewalk. They're all expected to survive. This all has brought the topic of gun violence front of mind for a lot of people. And joining us to discuss this is Dr. Dean Winslow with Stanford Health Care. Doctor, thanks for joining us. You lead a program that teaches doctors how to make gun safety a part of routine care. So tell us about your work.
Sure. Yeah. So again, we started an organization we call SAFE, or Scrubs Addressing the Firearms Epidemic, about 5 years ago now. And again, it was idea of both myself and one of our wonderful medical students who's now doing a surgical residency up in Boston. But we now have chapters at 62 medical schools all around the country, and curriculum, which you can look at online. We've got 3 modules that help teach doctors how to talk to patients about gun safety and reducing the risk of firearms violence, at least in their own homes. And in addition, we do feel very strongly that as doctors, we have an obligation to advocate for common sense regulation of firearms that helps reduce this terrible toll.
And mass shootings, I mean, they seem to become more and more of a frequent occurrence. So how have doctors needed to adapt to those potential emergencies?
Yeah. So again, of course, most of the time when a mass shooting does occur in the United States, that we're very fortunate in the U.S. that we have a system of level 1 and level 2 trauma centers that are capable of handling it. But the thing that I'd like to emphasize is that, again, certainly based on what I saw firsthand in Iraq and Afghanistan, if you're shot with an assault weapon, like an AR-15, your chance of surviving long enough to even get to the hospital is very small. The injuries from these weapons, which are the weapons of choice for mass shooters in America, are just devastating and very often not survivable, even with the best surgical care.
And what are some things that people at home should keep in mind in regard to gun safety?
Yeah, so I think, one of the most important things is to make sure that firearms actually are kept locked all the time if you do keep firearms in your home, and preferably the ammunition should be kept locked separately from the weapon itself. But again, I think the big thing that we really need to do is make sure that people who shouldn't be in possession of firearms, like people with severe depression who are suicidal, or people with a history of mental illness, but even just situational depression. These are all things that can contribute to either suicide or, sadly, homicide.
I'm curious, this is such a polarizing issue, and obviously you're coming from a medical point of view when talking about gun safety, but do you feel like you get political pressure also because of your views?
Well, certainly. And again, sadly, our country is very divided right now about not only guns, but also other issues. But, I do believe that, as an American, somebody who grew up in the middle of the Midwest originally, that there is a place for common ground. And again, as a former military officer, who carried weapons outside the wire when I was in Iraq and Afghanistan, I appreciate guns, but I do feel very strongly that assault weapons, which were designed really for use by the military, have no place, in private homes in the United States.
All right. Well, thank you very much for your insight. Dr. Dean Winslow with Stanford Health Care. Thanks for joining us.
Thank you for having me.